Hi, everyone. Welcome to the Lact Fact Weekly Podcast, which highlights recent clinically relevant research, policy statements, and protocols that you, as a practicing lactation professional, would probably like to know about. I'm your host, Dr. Ann Eglash. I'm a board-certified family physician and breastfeeding and lactation medicine specialist at the University of Wisconsin School of Medicine and Public Health. This podcast is written and produced by the nonprofit organization IABLE, which is the Institute for the Advancement of Breastfeeding and Lactation Education. We have no commercial funders for this podcast series. Today's Lact Fact comes from the following article entitled International Expert Consensus on Micronutrient Supplementation Use During the Early Life Course. And the first author is Cetin, and this was published in BMC Pregnancy and Childbirth in 2025, volume 25, issue 44. So first, for background, this study used a method called the modified Delphi process to find out what experts recommend about nutrition and supplements during preconception, pregnancy, and lactation. First, I want to explain what a modified Delphi process is. So first, the authors established a steering committee of 8 experts in the field of perinatal nutrition, and this committee performed a literature review on maternal nutrition during preconception, pregnancy, and lactation. Then the steering committee developed their first survey based on that literature review, which was sent to a panel of 35 nutrition experts. The results of the survey were used to develop a second survey with consensus statements, which went to 32 expert panelists. The goal was to identify where the panelists reached consensus on important topics related to maternal nutrition. The consensus was defined as 75% of these 32 experts being in agreement of the statement. I'm just going to cut to the chase and share what the panelists agreed on and therefore recommend in terms of maternal nutrition. So first of all, they recommend that healthcare providers have an important role in providing nutrition and supplement advice from preconception through lactation. They also recommend following the Mediterranean diet because it's rich in antioxidants, vitamins, minerals, polyphenols, and fiber. And adherence to the Mediterranean diet during pregnancy has been shown to reduce the risk of gestational diabetes and gestational weight gain. They also recommend supplementation with vitamin D, folic acid, iodine, and iron in the preconception period, so before they're even pregnant. And this is based on evidence that folic acid prevents neural tube defects such as spina bifida. In addition, iodine deficiency has a negative effect on brain maturation and overall development, and there's widespread iodine deficiency worldwide. Iron supplementation in the preconception period helps to reduce the risk of iron deficiency during pregnancy, which is associated with several significant maternal and infant morbidities. In the first and second trimesters, they recommend supplementation with vitamin D, folic acid, iodine, iron, and DHA, and folic acid in the first several weeks after conception benefits neurocognitive development. In the third trimester, supplementation with vitamin D, iodine, iron, and DHA are recommended. They no longer recommend folic acid in the third trimester because at that point it has unclear benefit. In terms of the postpartum period and during lactation, they recommend supplementation with vitamin D, iron, DHA, and calcium. And I'm going to talk about these a little later, particularly calcium. The panelists felt that the evidence to supplement with choline, selenium, vitamins B1, 2, B6, and vitamin K was somewhat too very weak. And lastly, they recommend that there is a need to tailor dietary supplementation use according to a person's lifestyle, such as the need for vitamin B12 for vegans. I just want to make a few comments about this study. First, I want to talk about calcium. The panelists actually did not agree on the need for calcium during pregnancy. So that's why that was not in their consensus statements, their agreed upon consensus statements, even though there is increased maternal absorption of calcium during pregnancy to help with maternal and fetal skeletal support. This is probably based on the assumption that women tend to get enough calcium in their diet, especially in countries that eat a lot of dairy. Instead, the panelists had high consensus that calcium supplementation is needed during lactation. However, we have good evidence that calcium supplementation does not impact bone density during lactation, and if anything, low bone density during pregnancy is a major setup for greater bone loss in the first 6 months postpartum. It makes more sense to me for women to take calcium during pregnancy than during lactation. The Center for Disease Control and the U.S. Institute of Medicine do not recommend more than 1,000 milligrams of calcium during pregnancy and lactation, which is the same recommendation for all women ages 19 through 50. A second comment is about iron supplementation. During pregnancy, the Institute of Medicine's recommended daily recommendation for iron is 27 milligrams, and the average daily intake is calculated to be about 14.7 milligrams a day. So it does make sense for pregnant women to take iron. However, during lactation, the amount of iron that's needed is only 9 milligrams a day, which can easily be achieved by many people dietarily. It would make more sense to supplement women who are low in iron due to poor dietary intake or previous iron losses from illness, menstruation, or childbirth. I don't see a reason to have every lactating person or woman take extra iron. My last comment is that I appreciate their recommendation to customize nutritional supplementation for the individual. There are several issues to consider regarding an individual's needs for supplements. Individuals may need certain supplements based on their chronic medications, food allergies, dietary preferences, health habits, culture, geographic region, and/or underlying chronic illnesses. In addition, women who are breastfeeding during pregnancy need special dietary counseling. It would make more sense that every woman have a nutritional assessment during preconception and/or during pregnancy and lactation to optimize their health for themselves and their offspring. Hey everyone, thanks for listening. I encourage you to check out iAble at lacted.org, which is LACTED.org, to learn more about our educational projects, courses, educational handouts, videos, live conferences, and webinars. By becoming a member, you are not only supporting our free projects, but you will also receive a series of benefits which you can learn about at our website. I'll be back with another Lact Fact in a few weeks.